Hi, I'm Megan Kingsley Gale with the Hospital Handbook Project, and I want to tell you a little bit about an event that we have coming up this Saturday on how to hire and credential acupuncturists into your healthcare system. So just one moment, and I will bring up my slides and show you some more information. So this Saturday, June 25th, will be our first public presentation from the Hospital Handbook Project's Employment Practices Workgroup. We will be presenting on how to hire and credential acupuncturists in your healthcare system with a focus on revenue capture and clinician retention. So it's scheduled for a 90-minute session, about an hour of our presentation, and then we'll have time for Q&A. So I will be presenting with fellow Employment Practices Workgroup member Paul McGee, who is the lead acupuncturist, outpatient acupuncturist at Penny George Institute for Health and Healing at Allina Health. So I'll kind of go over a little bit about what you can expect from this. This presentation is part of our Issues in Hospital-Based Practice webinar series. So if you haven't heard about that before, on the end slide here, I'll have some links for how to learn more about that. So that is a webinar series that's available to anyone who wants to subscribe to it. And we're always bringing up presenters for that series related to issues that the community brings up. So it's an ongoing series. It's a dynamic series based on what we need as a community. So this slide, our vision, we are the go-to resource for hospital and healthcare system-based acupuncture work, employment practices, and program standards. And our employment practices work group, and this presentation goes straight to part of that vision about employment practices and communicating about what employment practices are and best practices in those standards. What's unique about what we are at the Hospital Handbook Project is that we are a professional network community of hospital and healthcare system-based acupuncturist clinicians, program managers, researchers, and more. So why this topic? Why talk about this now? Why is this important? Well, this is an issue that we often see come up. The issue is, as a program or clinic in a healthcare system, you want to hire and credential your employees to be able to maximize your potential to capture revenue, codes, and metrics. And you want to be setting up an environment that successfully retains your clinicians, whether they're new hires or current employees. So one solution is coming to this event. We will be presenting on the basics of how to hire and credential an acupuncturist so that your healthcare system or program is primed to maximize your revenue capture potential and retain acupuncturist professionals in your program and system. So we'll cover some related topics that fall into this topic in our presentation. So we'll also be covering the minimum requirements for hiring an acupuncturist into your healthcare system. And this is important information for when you're writing the basics of a entry-level position description or job announcement for those entry-level positions. We'll also be covering revenue capture potential, like I mentioned, specifically about credentialing basics, codes captured as related to those credentialing basics, and more related to that. And then on the recruiting and retention part of our top part of our presentation, we'll be talking about how do you support the potential of your acupuncturist clinicians working to the top of their scope or to the top of their practice. And what is the current information, the current knowledge, the current best practices about recruiting and retaining acupuncturist talent in the healthcare system or in our healthcare systems? What are known best practices? So for this presentation, our content is intended for US hospital and healthcare system program leads, managers, and those hiring acupuncturists into their system or program. So this is, from the Human Resources Department when you're writing position descriptions and job announcements, as well as those working in the credentialing department, especially if this is the first time your healthcare system has hired an acupuncturist. You want to know what all the different elements and national standards go into the credentialing process and aspects related to that, so you can quote those national standards as you're putting together your credentialing standards for your system or for your program. And you want to, you know, if you've had a program for a while, and you may not know that in 2018, the acupuncturists received their unique BLS standard occupational code. And so we'll be presenting what that is and how that relates to, hiring and credentialing acupuncturists in the system. So if you haven't updated your credentialing standards for hospitals in your system, since that has come out, we'll be covering some of those things. So you can have that information for updating your standards. So again, with Who Should Attend, the content is specifically for those professionals. It is a virtual event, a public virtual event. So this is publicly available. So anyone who wants to buy a ticket can buy a ticket. And that's a link there. You can buy your ticket at that link, or you can donate to the link. We are a nonprofit. So there's a link for buying your tickets, and you can learn more about this event and how to access content at that link below. And here's just a slide with some more resources. I mentioned the Issues in Hospital-Based Practice webinar series. You can learn more about that on that page on our website. And you can learn more about our employment practices work group at this page on our website. So if you find this information interesting, maybe you're not interested in this specific presentation, but you're interested in our work in general, I recommend subscribing to our email newsletter to learn more about us. And that's the link there to subscribe to our newsletter, as well as to read some of our past newsletters. And again, you're welcome to donate $10, $25, any amount helps. It helps cover our outgoing costs for bringing you this presentation on Saturday, as well as just our general operating costs. We are part of a nonprofit. We are a program of Free Range Health, which is a 501c3 public charity. So all or some of your donation, if you do a direct donation, may be tax deductible. Please see your tax advisor, and that's our federal tax ID number. So I'm looking forward to seeing you at our presentation on Saturday. Again, I'll go back to the slide with the link to that ticketing page, and I will also add these links wherever I post this video. So looking forward to seeing you and hearing from you. Take care.